Okay, go ahead.
Dr. Harch, if you could talk about your animal study, and I'd like to talk a little bit about my experience with hyperbarics with my two dogs that had it, and then maybe you can talk about your dogs too.
Sure.
Let's talk when a multi-million-dollar race horse has a foal. If there's
They shoot it.
problems with the delivery, that multi-million-dollar foal can get hyperbaric oxygen, but babies with birth injuries from the delivery can't get it.
In Lexington, Kentucky, which is the center of the thoroughbred horse racing industry in the United States, they found out years ago the benefits of hyperbaric oxygen. They have a hyperbaric ICU at one of the main hospitals there
For the foal,
that
but not
treats, they call them redback foals, these baby horses born with birth injury, low blood flow, low oxygen one, just like human babies. And I'd wanted to put it in my book that the only place that in the United States that an individual, in quotes, could get hyperbaric oxygen for a birth injury is if you're a baby thoroughbred horse in Lexington, Kentucky. When we started, we made this discovery in the late 1980s that we could treat our divers with brain decompression illness. And we treated boxers and drowned children, etc. I started presenting this at meetings of the Undersea and Hyperbaric Medical Society. And the third year, I had three presentations, three different groups of patients: divers, a group of patients with traumatic brain injury, stroke, one child with cerebral palsy, and a group of carbon monoxide poison patients, all of them with significant delay to treatment. They were untreatable in terms of medical profession. But we gave them a different dose and they responded. So I presented all of these and I had brain imaging, functional imaging showing the changes before and after, the improvements.
went
People
nowhere.
didn't want to believe it. There is no way to fudge or fake these images. They are impossible to show what we show by manipulating the images electronically. And the response from the audience was, it would be more believable if I had an animal model to prove what I was doing. Now, I was 30.
That's walking backwards.
Yeah, it's walking way backwards.
So
So that was 94. I was 40 years old at that time. And I was naive and new to this, and I didn't know what to think. I said, okay, fine, we'll do an animal model. We went and found a well-characterized animal model, and we gave the rats of brain injury, traumatic brain
the
injury,
human protocol.
we gave them the
That's walking
human
backwards.
dose we were doing, and we showed for the first time in the history of science improvement of a chronic brain injury in animals. We grew new blood vessels in their damaged brains, and their lost memory came back. It was an injury to the memory component of their brain. And there it was. It's published.
And you would think that would be on the front page of the New York Times or Science Today magazine. It went nowhere.
Yeah.
It went nowhere. We couldn't get any press on it. And this is huge.
But more importantly, the doctors who claimed it'd be more believable if you had an animal model, that wasn't enough for them. That didn't make a difference.
There's the proof.
Yeah.
And is that why pet insurance reimburses for hyperbarics because of your study, Dr. Harch? Do you think that might be the reason?
I don't know because it came about in the pet industry. I don't know. I can't answer that question. But it's now an accepted treatment in veterinary medicine is hyperbaric oxygen for animals of all types.
Dogs, cats,
And there's insurance reimbursement for it, which
And
is just phenomenal. A number of years ago, our German Shepherd, the kids were playing fetch with it, threw the ball, and she ran under this low cement bench. And so she splayed all four legs out and did like a limbo underneath the thing. And in the process, herniated a disc in her back to where she was in terrible pain and was paralyzed. The right hind leg, the left severely weakened. She was dragging her body along. And finally, we took her to the veterinarian, and they wanted to operate and do all this stuff. And we took her home and went over to our office where we have the research lab and the experimental chambers, and we put her in. And we did this 25, 28 times. We had pictures of this German Shepherd with a oxygen hood on her head, and she just was as comfortable as could be in the chamber. First time we put her in, and it had paralyzed her bladder. The first time we put her in, she immediately came out of the chamber and urinated, and progressively got almost all, not quite, but a good part of her function back. She was able to run and walk and had normal function, lived another 3 or 4 years. But that was the first of our pets that we ended up treating.
Yeah. The children made a stretcher for her. So when the children would get the stretcher out, she would start getting all excited because she knew she was going in the hyperbaric chamber.
She felt good.
Yeah. Yeah.
And so knowing that information, I had 2 dogs. One was suffering from kidney failure, and she had an impossible surgery where it was like a softball-sized tumor attached to an adrenal gland. And having Trupanion pet insurance, they covered 90%. Went to San Diego, did that. She was supposed to not, different vets told her that's it, put her down. Went to the impossible surgery. She survived. 3 years later, she's down to 1 kidney. And she's getting worse, so I take her to the vet, and they give her gabapentin, 100 milligrams for a 39-pound dog. And then she started to get worse, and she was having just like seizures and not being able to walk. So they upped her dose to 300 milligrams. And I felt like that was a little much because I know grown men with 300 milligrams of gabapentin can almost put them down. And so I felt, what if I split the dose, 100 milligrams in the morning, and then 8 hours later, give the 200 milligrams. And that's when she started to decline overnight. And so I was doing saline solution, IV, not IV, or intravenous, is that right? Where I pinch the skin?
No, subcutaneous.
Subcutaneous. Where I pinch the skin, learn how to do that. So I'm doing it at home and go to the vet the next morning, and I'm getting yelled at by the vet, telling me this dog is suffering. You got to put her down now. And I said, I believe you're making your assessment off of the 300 milligrams of gabapentin that you gave a 39-pound dog. And she was offended by that. And I said, this is when hyperbarics is needed. And she said, what's that? And I found a place in Huntington Beach, California, Dr. Nato, Huntington Pet Vet, $50 a treatment. But the chambers were still in the box. She said, they just arrived. Can you come in tomorrow? I said, I'll help you figure it out. Figured it out. But you have to realize, going to that, I have video of my dog Emmy not being able to walk. I'm helping her, and she couldn't stand up just to go potty and stuff. She goes in the chamber.
Video? Perfect. Gotcha. I just cleaned it. The inside, got a nice blanket. Make sure to sleep comfortably.
Take her home. She lived for an extra 6 months, was no longer anemic, like 3 months into that.
Welcome back. Welcome back.
A different dog was a tripod dog, bone cancer, and she got some other cancer going on in the organs. She lived for an extra 3 months. But the crazy part about that is that my dogs were able to get hyperbarics. So 90%, I was paying $5 per treatment for hyperbarics. But when I go to the VA, they don't know how to deal with me. When I ask, why can't I get hyperbarics if my dog can get hyperbarics? Oh, there's not enough evidence.
They refuse to read it.
Yeah.
There's plenty of evidence.
And then
Right.
I said, so then I'll say, why can't they use hyperbarics off label in the same way that they use medications to treat off label stuff? That's a good argument. That's above my pay grade.